All right, thank you. Welcome to the July 2nd Board of Health meeting. I'll call to order. I'll take some roll call for now. Terry Reed, present.
Present.
Barry Potvin,
Present.
Amy Palmer,
Present.
Meg Payne,
Present.
and Deb Zona, our alternate, not here.
There's a Deb up there. Who's that?
Different, she's boy.
Oh,
Yeah. We do have a guest virtually. I think it's Deb Iaquinto. Thank you. And if for anyone on virtually, if you need to speak during public comment, please raise your hand, your digital hand, and we'll call you. But before we go on, I'll have to read the hybrid participation in person or via Zoom webinar. Pursuant to Chapter 2 of the Acts of 2023, an act relative to extending certain COVID-19 measures adopted during the state of emergency, signed into law on March 29, 2023, this meeting will be conducted via remote means and in person. As long as members of the public can easily access the proceedings in real time and participate remotely, until further notice, this meeting will no longer be broadcast live, but it may be watched when the show is replayed on YouTube. Members of the public who wish to participate in the meeting may do so in the following manner. They can participate in person at the Rope Walk Room located on the second floor at Plymouth Town Hall, 26 Court Street, Plymouth, Massachusetts. Note that the occupancy limit of the room may reduce the number of attendees that can be accommodated. And secondly, you can virtually, by joining the Zoom meeting ID 927-0778-6281 and passcode 267279. You may also send any comments or questions to publichealth@plymouth-ma.gov. It will be entered into record and as a practicable time permitting, read and addressed by the Board of Health. So our next in our agenda is the public comment in person or virtually. Do we have any public, virtual, or in the room? None in the room. We do not see a digital hand, so we'll move on. I would like to take a moment to put into the record the Retailers Association of Massachusetts, RAM, email that was forwarded on to the Board of Health members as public record. I'm not going to read the email, but if we could add it to the minutes when we approve those and publish those. Next on the agenda is chairperson's announcements. This is my first full Board of Health meeting with the agenda that we developed together. You'll see that just from my perspective, I do like having an agenda with a lot of more details and specificity. So we'll go through that and be part of that. The other announcement I'd like to talk about is the board of, or the select board in a previous meeting did what was it? They read and reaffirmed on the June 3rd select board meeting guiding principles for the town of Plymouth. And just briefly, I just wanted to touch on this. The guiding principles outline what is expected from employees, members of all boards and committees, town meeting members, as well as any others involved in the town's governance in terms of interaction or on different subjects. You can read that through the minutes at the select board. It's something that we should just know in the back of our heads. I think we do that already as a board. At least my last 4 years, I've seen our interactions have been very, aligned with those guiding principles. But I just wanted to note that as something that our board will, try and follow as I am the chair for this coming year.
you think that was June 3rd was the meeting?
Yes,
Thank you.
the June 3rd meeting. And that is my announcements that I like to present. So the next, any questions there before I move on? Barry,
I have no questions.
thank you. Next on the agenda is the e-bike discussion. Dr. Terry Reed and the police department representative. Today, I think we don't have a police department representative, but
I can
from-
read what
yeah, you
Chief Flynn
can,
sent if you'd like.
please.
Sure. So I did reach out to Chief Flynn today. He did not have anybody available just because they are short staffed. Well, they're pretty stretched thin with the week, holiday week.
Yep.
We are currently working with the select board and council on a solution to the e-bike concerns. As you know, they are regulated by Mass General laws and are guided by the same laws as pedal bicycles, with the exception e-bikes are prohibited from sidewalks. We have done a number of PSAs on our website, and the Plymouth Independent ran a story. The road for bicyclists of all types. E-bikes are an important mode of transportation for many people and are used by my own bicycle unit. The problems that Plymouth and many communities around the country are having specific to operation by and lack of guidance.
So, Dr. Reed, I know
Yes,
you put together a presentation.
I'm a member of the Academy of Pediatrics, as my position as a pediatrician. And the American Academy of Pediatrics makes recommendations for various healthcare issues. And their most recent one actually is e-bike. So their recommendations, and these are just recommendations. I'll go through actually the Massachusetts law as well, a little more detail than what the chief did. The AAP recommends that you be at least 16 to operate any e-bike. As they have always felt, helmet use is crucial to preventing head injuries, which are a huge problem with people on bikes or e-bikes if you fall. They also recommend that the rider has some sort of education with the use of the e-bike. So I would, they are recommending that towns start to have classes teaching children, kids, and adults how to use an e-bike. Because there are some interesting things about them. There's different classifications of them. There's different speeds, and that affects what you do and what you don't do on the bike. And there's different motor assists. So,
Yeah.
The other issues they recommend are to know the traffic rules and to be able to use the hand signals and be aware of your surroundings. All these things could be covered in a kind of a class that people could get. But if they aren't, they encourage parents to teach them. They also think that they need to have somebody that's paying attention to the brakes, the lights, the tires, the battery, because this is electric. It can certainly cause more damage than the regular bike, so these things need to.
Terry, how fast do they go?
I'm gonna tell you in a minute.
I'm so excited.
I know, well, I think a lot of parents don't know this, and so this is just information for people to use their best judgment. And then the last thing is they actually recommend that they should be supervised when using an e-bike, and that new riders for sure should be accompanied by an experienced rider. Now, that doesn't mean you're on the bike with them, but at least you're riding with them. So next to them on an e-bike or another bike. And then, of course, distractions, they recommend people don't use headphones while they're on the bike so that they can hear their surroundings. And certainly not cell phones, texting and talking and those kind of things are all distractions. And then finally, wearing bright clothing, in addition to having the brake or the bike lights work. And especially in low light conditions. So those are the recommendations of the Academy of Pediatrics, and they feel very strongly that people under, the age of 16 probably ought to avoid using these bikes. Now, as far as Massachusetts goes, Massachusetts classifies the bikes. This is your answer, Amy. Class one is what they call a pedal assist only, with a motor assistance, that won't go higher than 20 miles an hour. So you can pedal and then you can click in your motor assistance as needed, but it only goes up to 20 miles an hour. The class two is what they call throttle accentuated motor, which means you can ride it just without pedaling right from the beginning. And, but the assistance ceases at 20 miles an hour. So it's basically, you're not gonna pedal it, you're just gonna sit on it like a little motorcycle. And then, class, three, which, just to mention the motor limits, the actually maximum, motor power is 750 watts in those two classes. Now, Massachusetts law doesn't define a class three, because if you look at it closely, it kind of lumps it into, motorcycles, motorbikes, so it sort of matches that. But if I were to define it, it would be anything, or a pedal assist that would go over 28 miles an hour. So you got the pedal assist and the motor, and, that would be like a motorbike that just has the motor, goes over 28 miles an hour. Okay, next, now they say that there's no license required for riders in class one and two. So that you don't have to get a special registration or a license. The age restriction, riders of any electric or motor assisted bicycles that exceed 20 miles an hour on its own must be at least 16 years of age and have a valid driver's license or learner's permit. So that to me says that below, the class one and class two, which are below 20 miles an hour, people below 16 can use it. And I'll remind you again that the Academy of Pediatrics really feels that, developmentally that is probably not good. It should be 16, but we allow it. And then sidewalk restrictions, as the chief of police told us, is prohibited on sidewalks on all the classes, so that's all the classes. Next, they can go on some bike paths and bikeways, but you need to know the specific laws of your local, community. And then lastly, the head helmet issue, we have a helmet issue, we have a helmet law here that does not mandate, that you have to use a helmet in, Massachusetts, but they do strongly recommend it.
You were, well, not mandated for those 17 and older. Is that under 17? Is that a law that you have to have a bike helmet?
Ooh, I didn't look at that.
Okay.
Bike helmets. I don't know.
That's
I don't
okay.
remember.
Yeah, I don't know if it.
Yeah.
Yeah. See all those little kids driving around
Yeah.
without a helmet. Makes
Yeah.
me angry.
So we just present this information for parents so that they can understand what they're buying for their kids and what they're allowing their children to use, and then what the law is. And unfortunately, we've had two major accidents, one in town and one outside of town, that have resulted in severe, health issues for both children. One that's still in the hospital at Boston Children's. So I think it's a good idea to, this is a fun thing to do, fun thing to give your kids, but I think it shouldn't necessarily be looked at just like you're gonna have a bicycle. Any other questions?
I asked mine.
No, you're so much fun.
Barry, did you have any questions for
Uh,
Terry?
no, I mean, I've seen, young guys on e-bikes here in the Pine Hills. Out on the roads, so I don't think they were breaking any laws, they were wearing helmets. But certainly it looked like they were moving faster than 20 miles an hour to me, but I didn't have a radar gun.
Meg?
I don't have any questions, thank you.
Yeah.
Could we put this on some of this on our website to just at least the classification and stuff like that, so that people can understand the law?
Yeah, or maybe, the questions I had was the Association for Pediatrics, do they have a website that endorsed this recommendation? So
Yeah.
it's
All
probably,
their recommendations are there. If you go to the American Academy of Pediatrics and look for health recommendations.
Right.
They're all listed.
I think that might be the better route to point to them. Because this is really their recommendation rather than the boards, but
Well, the
this-
classification though is in the state law.
state law,
Yeah,
yes. But those prior to this recommendations, there was,
yeah,
prior to the state law slides, there was the recommendation.
right.
And I'm sure with the police department and fire, it's safety, public safety, gonna have a forum around this topic. To me, one of the questions I had is, there's e-bikes and e-scooters, right? And those are
Which are, I didn't even
just as
mention that.
right, I
That's
didn't
okay.
even mention that. And then there's, the legislation that might be done at Beacon Hill.
Mhm.
It's just such a changing situation, but it's definitely
Right.
something that needs awareness as we're bringing support to folks, and maybe parents just don't know better,
Mhm. And I think the e-scooters can go on the sidewalk,
right?
so that's a whole different thing. Knocking people down.
Yeah, no,
Yeah.
I've seen
That's what we were
the
discussing
e-scooters
earlier.
Yeah.
on the sidewalk.
Mhm.
In Red Brook, there's some paved roads and
Mhm.
streets along Wareham Road. And you'll see the e-scooters zipping through and to Barry's point, I didn't have a radar gun, but they zip by pretty quickly and they zip, they'll brush you, they'll come close, so. Well, thank you for that, Dr. Reed.
You're quite welcome. I would also recommend that if they do have a forum, the police, that there's a representative of the Academy of Pediatrics on it. To give the recommendations.
Okay, thank you. The next agenda item is reviewing our Board of Health goals and objectives. Amy Palmer will go through that. if you
Yeah,
want to. I took a read of that and it's great to memorialize that. I think the select board does something similar with a review of their past year.
Yep.
And they kind of go over their goals. And if we do that as a process going forward after, the yearly reorganization, just to kind of say, hey, what did we do? And when we have this document that's evergreen, we can just add to it rather than, like our performance reviews at the end of the year,
Yeah.
but for those of us who are starting to work, we still work, you sit there and go, what did we do 12 months ago?
Yeah.
Right? So, but
And
thank you.
I said to Lorenzo, we were without internet service this weekend, so we were like kind of at a lot. So to be able to get everything to you guys so that I could go and review the previous agendas so that I remind myself of where we were at with it. But I think with this, when we had talked about it years ago, a lot of it was around the foundational public health services that we offer. And then topics that we were all interested in. And I don't know if you wanna revisit those topics to figure out like, what do we want to address for the upcoming year? Which I know can be hard because sometimes topics come up, like I know the rodenticides and the SCARs, that kind of like popped into our lap when something, so it's. I don't think we can necessarily predict, but I do think we could probably start a conversation around what we want to see next year look like or focus on next year.
Absolutely. Did you want to go through the presentation or?
We can, do you have it on the, no?
You have, okay.
Sorry.
We'll do it.
I sent it to the board, I'm sorry, Dana, I didn't send it to you, and then so a lot of it was, like the training manual and the onboarding that we had talked about originally, the, the laws and regulations, and we talked about this around FOG, like what do we need to address every year with the board and with new board members to kind of figure out what's some topics, and maybe we can discuss that amongst the 5, 6 when Deb's here, and then we can talk more about what we would wanna see. I think the presentation's good to kind of highlight what we did do, and I'm happy to represent it in a more organized manner at the next meeting.
Yep.
And then if people wanna kind of let me know, maybe we could go over what people are interested in. I don't think we've even talked about it since you've been here, Meg, is this?
Right,
No,
Think of the topics that anybody feels they might want to address from a, board perspective.
yeah, I think high level, what we kind of settled on was education, awareness, and community presence.
Yes.
And then from those 3 pillars, we drove down to a little bit more detail around that. And then we can align some of the things that we did that result in education, awareness, and community presence. Fit that. There's some of the blocking and tackling that we do from a regulation standpoint, the variances that we talk about. Those are things that we do as a board that we have as natural, kind of longstanding agenda items. But from a goals and objectives perspective, those are really the 3 areas. And then the document that we discussed or had as objectives and goals.
Too.
Right, but it's a good start to understand, what I think. We have to just be cognizant of is like chewing too much, right?
Yes.
I mean, we are a limited board, we're, as we noted before, 5 volunteer folks with plenty of experience and skill sets. But we don't necessarily have staff and we don't have ways to do that, but we do work within the auspices of what's regulatory given as authority to the board. So those are the things that we can do and kind of move the needle around those areas of education, awareness, and community presence.
And I really do like those 3 highlights, to be able to use those as guidance and also, focusing on the social determinants of health to know that that's where we wanna focus our, education, awareness, and community involvement. So, I guess I would ask people to, if you want to discuss now what we're interested in, and I can put something together for the next meeting, or if we wanna communicate through email afterwards. Go ahead.
I think that we could discuss now, if someone has anything top of mind, just so that we could, have it down. But then send those kind of details to you, and then not necessarily discuss it over email, but
Right,
discuss it in here in
Yes.
this forum.
Yes,
But at least we can memorialize it, have it through the process, and then we
Yeah.
can kind of understand it and then have our open discussions
And-
as a
yeah.
board.
and I was thinking more, people could just email me the topic,
Yeah.
and then at the next meeting, we could discuss it more.
Right.
Rather than not have the, it's one of those things, like I saw on the previous version, we talked about PFAS and cyanobacteria blooms and stuff, and I don't think we've talked about that much, and I don't know if that's something people still wanna focus on, or if we feel like we're pretty, as concerning as cyanobacteria is, I feel like in local health, we've kind of done it to death for the past few years. But it keeps popping up. So is it something that we want to educate the board, or is it something that we want to? I feel like this health department does a great job educating the public because it keeps popping up all over town. So I don't know if that's something that we want to focus on still, or if there's some other environmental hazards that people have popped up that people are concerned about.
I think from a water safety perspective, the department does testing of the beaches, right? That's weekly. It's almost like,
27.
right.
27 different beaches or 20, yeah.
And that's all done through the department, correct?
Well, so it's a,
If you could explain, yeah, that.
sure, so it's actually a private contractor that goes out, actually conducts the sampling, and then they send us the results. It's up to us to analyze and make sure that they are within the state parameters set for beaches. For both E. coli and enterococci, depending on if it's freshwater or saltwater. And then we have to upload all of that to the state. If it is over the threshold set by the state Department of Public Health, then we need to reach out to that beach operator, make sure that they are testing the next day and posting signs to keep people out of the water.
Okay,
It's a lot.
it's a lot.
Yeah.
It's a
Yeah.
process, right?
Yeah, like
And-
I just finished last week's uploading today. And by the time I walk into work tomorrow, I will have the next 27 results.
Right, so it's 27 bodies of water that the town is
That we
monitoring.
know of, yeah,
Okay,
yeah. And those are like, some of those are like semi-public beaches, so if you like West Wind Shores is one where they have like a beach just for the homeowners.
Mhm.
But because it's used by all of those people, it's considered semi-public. And therefore the state needs to know about it, and it does have to be posted. Whereas Plymouth Beach, White Horse Beach, those are public beaches. And the same rules to apply. So there's probably some homeowner associations out there on beaches and ponds that we don't know about. Because
like White Island Pond.
we test for that,
Okay. good.
yes.
Oh, that's one of them, yeah, because there's a beach I see
Yep,
there.
yep, we tested that.
So in my mind, I'm thinking Boot Pond, because I have a friend and they're all private access, so you
Mhm.
don't test Boot Pond.
We do not test that one,
Right.
but if it was one that was like operated by the homeowner,
Right,
like a
it's not.
homeowners
It's just a
association,
bunch of
yes.
people that live on the pond.
And happen to use
and
that
happen to
area,
use it. Yeah, so you wouldn't test that.
right, right, yep.
In terms of
Mhm.
cyanobacteria blooms, which department has oversight for that? Is it environmental services, or if someone were to see like the algae mat, for example, and you submit it into Plymouth, how does that make its way to, hey, you know, these signs go up, there's a cyanobacteria, until this goes away, you should not go into the water.
So I work mainly with Kim Tower of the Division of Energy and Environmental Affairs on that. And we have really constructed a good collaboration between the two departments, making it so anybody, any resident can report it to either department.
Okay,
And it's going to get taken care of. If I find out about it, I'm gonna work with her and vice versa.
okay,
They will go out and actually post the signage. We field all the calls. We are the ones that are technically issuing an order and the advisory.
right,
But they are the ones, they know.
So they're the
beaches
ones that are
inside and out.
checking it.
Yep, so they'll go out, they'll look at it, because Kim is a scientist, he knows exactly she knows everything and anything about cyanobacteria that you could possibly wanna know.
Mhm.
So she will take a look at it and work with the state as well. And then, like I said, we field all the calls and try to educate the public as to, you know, what not to do, and we can't prevent them from
Sure.
going in the water, it's an advisory. But, you know, we tell them, do not let your dog drink it,
exactly.
for sure, you know, don't play
Right.
ball, and it's just, we do advise them on what the dangers of it are.
Yeah, I didn't know the process, but so when you look at it, you could see it.
Mhm.
But is there a testing piece to that? Do they actually take water samples, and
Usually not.
it's really
No.
visual, more visual?
It is more visual. Sometimes we, well, Division of Environmental Affairs,
Mhm.
they will sometimes take a sample. If it's a really odd one, just to, or if it's lasting a really long time, they'll take a sample and send that off just to kind of see how many colonies there are, what particular species of cyano it is, because that kind of gives us an idea too of what is causing it.
Yeah, cause you know, when you think about that, if I was living out next to that body of water and I see this advisory and it hasn't gone down in 3-4 weeks, I'm gonna go, how do I know when is it safe?
Yeah,
And then that, you know, starts discussions around with the citizens or the
Mhm.
homeowners. Around that body of water to say, you need to be doing some mitigation somehow, because if you're. You know,
Right.
there's an issue here and it's kind of your, you know, issue because it's a product, yeah.
yeah, and that's, you know, and that's part of why they take the samples, because that will also tell them what's causing it. So
Mhm.
sometimes it could just be, you know, usually it's an excess of, phosphorus. And I believe it's nitrogen in salt water, phosphorus in fresh water, and I could have
Okay.
that backwards.
Mhm.
But that's kind of how they can tell, so they can tell, is it coming from cesspools? Is it coming from, you know, a lot of runoff from lawns,
Mhm.
right?
Right, so I mean, this all connects with kind of the septic variances that we see and the cesspool
Yes.
mitigations that we do and
Yes.
all of those things as a department and as a board that we, you
Yeah,
know, those have.
we're one
downstream
big Venn
effects.
diagram. Everything overlaps. Yeah.
Oh, that's awesome. No, that's good. Um. Any other questions on goals and objectives? I think oh, Barry, the
Yeah.
digital hand is up.
I do know how to use the digital hand. So a couple of things I can add that I've just seen recently. The problems, I mean, actually, Margaret is right. It's phosphorus accumulating in fresh water, and I guess it's nitrogen in the salt water. Lake Winnipesaukee is a rather huge body of water. They're having a problem with cyanobacteria blooms to the extent that they had to close some of the beaches that line it. And again, they were concerned, well, where is this stuff coming from? And it's mostly being caused apparently by a lot of development along the shores.
Oof.
And a lot of that is related to the overuse of phosphorus containing fertilizer. And a lot of it also is because of improperly maintained or non-functional septic systems and cesspools. So, I mean, those are the things that seem to be primarily responsible for that, but they've seen an increasing problem with the higher environmental temperatures. Because obviously the warmer temperatures encourage the growth of the algae. And once that happens, you're going to get a lot of the toxin. So it's not just us. Even way up in a huge body of water in New Hampshire, they're having the same problem. And they're really worried at this point. They're just going to get worse and worse and worse.
Maybe that's a topic we cover next, like with this year.
Yeah, something that we can look forward to through the year, because it seems like the blooms happen in the summer, right? They don't
Temperature.
necessarily have the temperature
Mhm.
regarding that. When the water starts to
Yeah.
get it's shallow water and temperature goes up and you've got all this mixture, kind of a perfect storm coming together. Next thing you know, you get this mat and the bloom.
You see it a lot of times too, like after you'll have like a lot of heavy rains, a period of heavy
Mhm.
rain, and then one day the sun is out
Mhm.
and it just explodes.
Yeah.
I kind of cringe when I see that forecast.
Cause you know it's gonna have that runoff from
Yeah, I
people's
know,
lawns
it's coming.
and all that stuff.
Yeah.
Okay. Thank you, Dr. Poffin, for that. You're a resident scientist.
Well, I sort of specialize in environmental health.
Absolutely. Our next agenda topic is the Citizens Advisory Representatives. This is kind of near and dear to my heart because I went through this process with Dr. Potvin, mentored myself. joined that, so, and was part of that. And really piqued my interest further into getting involved as an alternate on the Board of Health and then becoming a full member and then a second term. So it's important. In addition to, I mean, it's not part of our topic, but it'll be our you know, the school, the high school folks that are involved, but you know, maybe it's something that we can discuss and have, and get back to where we can have not necessarily, they're part of the board meeting, but, a readout of someone on the board that can, have, work with these representatives. And then as they get more interest, they'll be sitting in our audience and they can add, some information and provide some knowledge and expertise. As Dr. Reed, you mentioned, we have so much of that in the town of Plymouth. And it kind of lines up with succession planning, right? Having the next group where they can step up and you can see that you can witness how the board works with the public health department division, how it works with Health and Human Services and all the other entities within the town to move the town forward. So I'd like to you know, see if we could reconstitute that and would ask for, you know, comments or suggestions on how we could do that going forward. You know, do we simply just put something up on the website? Do we through our own connections say, hey, you know, I know that you're interested in public health and I talked to you about it within our own personal networks. How would you be interested in joining or being part of the citizens advisory representatives? And it would be, you know, something like once a month kind of thing, time commitment, and then we can talk and it doesn't necessarily have to be that formalized. So thoughts from the rest of the board members?
Well, I'm trying to, because I did the same thing, and I'm trying to remember how many people, were there 3 or 4 people that were, and Baron, you might remember too, you were part of all of it.
Yeah, when I went through it, there was, I remember 2 or 3 at the most,
Yeah,
right? And sometimes it would just be Barry and I talking things, because I would miss the Board of Health meeting or I didn't attend it. And Barry would talk through that, but someone, a Board of Health member would help through and foster and be an enabler of that conversation with these citizen advisory representatives.
mhm,
And I think when we think about being community presence, it's not a pure sample,
right,
but it is a pulse when you present this opportunity for the community beyond the forums and webinars and kind of the meeting that we have today
mhm,
as an outlet for those who are more interested in public health.
right,
You know, and you know, they're committed to it, they attend regularly, and then you can get that kind of feedback loop from the community. And then use that as a mechanism.
mhm,
It's not statistically scientific, but
Right.
it's a start.
yeah.
Yeah. Well, the thing that I would like is for our community to understand what we do better. And I think the way to do that is to get more community members involved.
Yeah.
Because I think that sometimes we're looked at as just, you know, making rules and regulations and dictating things and. I think there's other topics that they could come up with. That we can't think about, you know, we're sitting here saying what we think they need to know, but they may say, I'd like to know about this, or the community might like to know about this, that we've never thought about.
Right.
So I think there's a lot of people out there, a lot of people who are involved in their own little niche of something that I learn about when I go to the school meetings all the time. There's like this program and that program, and there's always a leader of that. And those would be the people that would be interesting to get tapped in with this.
Sure, that would be one way, you
Yeah.
go to those other, groups that you have access to. And then you say, hey, the Board of Health is starting a community advisory represented. Representation, would you like to attend? And then we could put the name in and then we can kind of
Yeah.
put that in place, I know that we're all volunteers and we have time and, this is something that's passionate in myself. I would be more than happy to bootstrap it, but if anyone, feel free, it's not gonna be a Board of Health Board of Health meeting per se.
Yeah.
But it'll definitely be one or two of the board members and try and keep it so that there's, one or two board members, so it
Mhm.
doesn't become a
Yeah.
meeting
Yeah.
per se.
Mhm.
You know?
Barrett's listening.
Very,
Yeah, well, I thought I should provide some history.
Yeah.
Because obviously when that idea first sort of crossed my mind, first thing I thought of was, how am I going to get this new initiative out there to the community? And that's the major problem. So what happened was I did at the time have a connection with Old Colony Memorial and their digital version. There was no Plymouth Independent then. And so one of the workers at Old Colony Memorial said, I'll just put a notice in the paper for you about it. And just let them know that there's an opportunity for this. And if they wish to participate, they should just contact you or contact the department. And I guess we ended up with, I think you're right, Lorenzo, maybe 2 or 3 or 4 members tops. And we had to make sure that there was no more than 2 board members, because otherwise it's an open meeting violation. But there was a lot of discussion. We'd go through the agenda for each of the upcoming Board of Health meetings. We'd, gather information about what they thought was a major problem that we had to confront. And that would feed back into the Board of Health meetings. I thought Lorenzo was the only one that persevered through that to the very end and becoming a Board of Health member.
No, I did.
Amy,
Amy did too. So we managed to corral 2 people from that group who ended up on the Board of Health. But there were others that just sort of dropped out during the time.
I have the statement that was initially, so I actually have what was published and the exact layout of it. And don't forget, we also still have our press release person, Casey Kennedy, that can put
Sure.
something out, and that goes out like as a like an e-alert almost.
Mhm.
So that's another way that we can get that information out. Originally, it was the Citizens Public Health Advisory Council, and they were to advise on public health matters and make recommendations to the Board of Health and Director of Public Health. Council can also obtain citizen input regarding public health issues, serve as citizen advocacy group for public health programs. And let's see what else. That's going to consist of 3 members initially appointed to either 1, 2, or 3-year terms by a majority vote of the Board of Health. Subsequent appointments and reappointments shall be for 3-year terms. And then what they did is just had the people interested email like a letter, their resume, their qualifications, their interests, whatnot, to Karen by a certain deadline.
no, that sounds great. I think that we could, let's not reinvent the wheel. Let's do something like that. Maybe tweak the edges a little bit. And
Yeah,
then we'll have that. And with
Maybe-
Casey Kennedy now,
maybe even get a story in the Plymouth Independent.
yeah, we'll have Casey take care of it. Yeah, I mean, one of those would be
Yeah.
a channel that we would use, but we should leverage Casey Kennedy, the Plymouth's communications point of contact. I think that would be good.
I would also though encourage each of us to personally talk to people too.
Oh, yeah.
Because there's nothing like someone coming up to you and saying, you know, I think you'd be really a good asset to this and would like your input. You know, if I read that, I would maybe be a little more hesitant.
Yeah, I think, I mean, people like to be asked to do
Yeah.
things, you know, they like to be included, so I think that would be a good idea.
That'd be great. I think that, given that if there's no objections, oh, Barry, go right ahead.
Yeah, as an example of that, about 4 days ago, a new couple moved into a home directly across the street from us. And of course, when something like that happens, you go and introduce yourselves and talk and find out about them, and they find out about you. And it turns out that one of the people actually works in a medical care setting somewhere down on Court Street. But there's also a sister who is a semi-retired nurse, and they have a daughter who's interested in nursing. And I mentioned, you know, the Board of Health and our Public Health Excellence Grant Program. And they said, oh, this is great. We have to talk, we'll talk to my sister and my daughter about this. So, you know, that's one of the things you just keep in your mind as you meet people, because you will find people that are actually involved with healthcare and with even occasionally public health.
No, agreed. So I think if there's no objections, we'll work in behind the scenes to get that started, you know, send out, work with Casey, maybe when Karen gets back, tweak around. Margaret next week or the following week.
I just sent you the, what I read.
Okay, thank you very much.
So you can tweak that and get started on it.
All right, we move on, the community health assessment update, Meg. So if you can give us an overview of that, I know it's something I heard about, but I haven't really seen much information about it.
Yeah, so the town of Plymouth is conducting their first ever community health assessment, which is really exciting. It's being led by the Health and Human Services Department in conjunction with an organization called HRIA, which is Health Resources in Action. So it's a Boston-based company. They work all over the place. They work to advance public health and health equity through research, policy, capacity building, grant making, and community engagement. So we had our steering committee kick off on June 12th at the CAL, the Center for Active Living here in Plymouth. The steering committee is made up of several members with broad representation, public safety, the business community, housing, healthcare, and more. So we had our kickoff meeting, it went really well. We were introduced to the HRIA team and kind of what the process and the timeline looks like. And we had a chance to kind of chat about our initial thoughts about what the needs and the gaps are in the community from our perspectives. So basically, the purpose of the health assessment is to collect and analyze information from the community. So really, again, I mean, it's totally in alignment with what we're saying here as far as education, awareness, and community engagement. Reaching far and wide in every nook and cranny here in town, trying to gather information. And then we're gonna put all of the data together. We're collecting quantitative and qualitative data. We'll identify priority needs, and then together we'll come up with a community health improvement plan. And then I think after it's been implemented, there is like an analysis evaluation period as well. So it's really exciting. It's a really great opportunity to hear from the community. You know, we can all sit here and think about like, oh, topics that we're interested in and we want to hear from, and I know we're residents and we live here too, but just to have a broad representation of different communities that we might not see or interact with daily. So our next meeting is currently being scheduled. So that's the update I have for you.
That's
That sounds great.
Who's funding this?
I believe the Health and Human Services Department. Yeah, I couldn't
Yeah.
answer that
Probably.
but they're leading the charge, so it's coming from them somehow.
Yeah, I think I saw in one of the more recent select board meetings, their goals, and that was one of the items that was kind of in progress when they did a year in review of their objectives, the CHA. So that was the only time I saw a CHA, and I was looking forward to hearing a little bit more of how that was structured and in the town. Question to you in that steering committee was, because I'm familiar with the CHN, the CHINA, Community Health Needs Assessment that's done by the hospital systems of the community.
Yeah.
And they're required by every 3 years and all of those things. So this seems to be in addition to that. Is there a BID representative on the
yes.
steering committee?
Yes,
Okay, good.
they were invited, I'll say they were invited. I don't know, they weren't present, there were some people not present, so I don't know for sure, but yes, I know that they definitely plan to use the data collected from that China.
Mhm.
To kind of supplement what our findings are.
Yeah, because that's readily available from BID, and they've got so many hospital systems across the Commonwealth that they do these things. You know, like the back of they have a whole department that does chinas all the way. I mean, we do it, you know,
Yeah,
and
so
Cape
they-
Cod Healthcare does a china for Barnstable and.
They all use HRIA too, that seems to be the standard.
Okay.
Oh, that's good.
Yeah.
Good. Barry, your digital hand is up.
Yeah, I'm getting good at this. So I just want to mention that the person at the hospital, BID Lady Plymouth, that's primarily responsible for that kind of thing is Karen Peterson. That's what she actually is doing. She's heavily involved in it. And I sent out a copy. I don't want to, overemphasize anything, but Devin Donovan, who is our epidemiologist that's been hired full-time by the Public Health Excellence Grant, accumulated by just using data that's available online, tremendous amounts of information about health profiles for our 6 towns, of which of course Plymouth is one. It wasn't done by, getting information feedback from individual members of the communities. It was something that she just did a deep dive into available online information. And she came up at the end of this, and I think you've all should have gotten a copy of it along with the Public Health Excellence Grant website, where you can access it all. It's lengthy. It has demographic information at the beginning, and then an awful lot of health information that came off of her online searches. And I think the one for Plymouth is at least 68 or 70 pages long. It's an enormous document. It was an enormous amount of work. It's also been shared with Michelle Brady, with the select board, with all the Board of Health members, also hospital officials, Kevin Coughlin, and the head of medical services, Dr. Tenny Thomas. So it has been spread a lot. And I think that, what has to happen is there has to be some kind of, coming together to coordinate, efforts and have discussions among the interested parties. And matter of fact, for the town of Plymouth, what Devin found was that there's a problem with hepatitis B and C in the town of Plymouth. And the way to approach that is with making the public aware of it, providing educational opportunities, and certainly providing the knowledge that there are vaccines available for that, which I believe is actually one of the vaccines that's required for school children. Plymouth also, for not big surprise, has a major problem with binge drinking. There's an awful lot of bars in Plymouth, and there's always something happening with that. Like a lot of the other towns, there was a problem with low ratio of primary care physicians. And so as a matter of fact, Devin has an intern working right now. Ryan is working on this, trying to put together lengthy list of all healthcare providers in the Plymouth area, along with their availabilities and whether they take new patients. And the one that kind of strikes home for me is the cancer incidence investigation. They have something, if you look at the Department of Public Health website, comes out about once every 5 years. And the latest one went through 2020. And they do something called standardized incidence ratios, SIR. And for those that know about that, what that means basically is they adjust for age differences in the population, which of course has something to do with cancer also. But when we started looking at Plymouth, it became immediately obvious that there was not only some problems with skin cancer and melanoma, there was also a problem with leukemia and even thyroid cancer. And those numbers were elevated in a statistically significant manner above what the state averages were, above what was expected. And when I started looking back at these data that came out from the state DPH all the way back to before there was even a nuclear power plant here, about 10 years after the power plant went into operation, the numbers went up. Before that time, the numbers were about around the state average. So again, a caution, and Amy knows this, I think too. There is no proof involved if you see a positive correlation between something and something else. It takes a lot more to prove that than just a correlation. But it was extremely suspicious because of the time frame. So what we need to do, and I think it's going to involve the Board of Health, it's going to involve the Public Health Excellence Grant, the hospital people, probably the other members of the town that are involved in the current sort of study that's going on. We have to find out where in the town of Plymouth exactly, or at least in a rough way, these higher levels of cancer are actually being observed. And then we have to do a deep dive to try to figure out what are the possible causes. And if you can find a cause, then it might be possible to do some remediation for that. But again, don't reinvent the wheel. There's a massive amount of data already present and accessible that, thanks to Devin Donovan, is now easily accessed, not only for Plymouth but for all of our 6-member towns. So if you haven't looked at that stuff, I would urge you to look at it if you're involved in this kind of study, and hopefully we'll be getting involved with the hospital too.
No, thank you, Dr. Potvin. The takeaway from that is that, there's 3 kinds, the word that I focused on was coordination, right? So right now, what I see is the takeaway, there's the PHE documentation, a grant that was delivered by our epidemiologists through that grant process. There's the CHINA from BID, and then now we're Plymouth-driven CHA, right? And so all those circles are going to have that overlap and coordination, and it's resources that we use. So maybe going forward, you can look at efficiencies or things like that can, through partnerships, get more efficient. But that's a long-term kind of thing. But at least coordination is a key part of that, and understanding that, which is kind of a good segue to our Board of Health liaison appointments. When we think about the different entities that we are involved in as a Board of Health, whether directly or indirectly, these listed out are some of the entities that we work with that Karen identified. I mean, we can all kind of identify and build a list, but we should go through this and do the kind of appointments from at least the Board of Health that we should moving forward. So the first one on the list is the Nuclear Decommissioning, the NDCAP Advisory Panel. Sounds like Dr. Potvin, you're the current resident on that, right? You're you go to those meetings and attend them on behalf of the Board of Health or some other town entity?
Well, I was going to those for quite some time. And then, I noticed that there were 2 vacancies that the select board was supposed to appoint. And they hadn't for a long time. And I talked to some of the other state officials about it, and they said, you know what? I think there's a way to get you appointed to that commission. Next thing I knew, that I got a letter from the president of the state senate appointing me for 4 years as a member of the NDCAP. So
Great.
I'm not only representing, the Board of Health if they wish to be represented by me, but I'm now an official member of that group. And of course, my perspective is one of protecting public health. And so, most of the other members don't have that kind of background like I do. The select board did appoint 1 new member, I think at one of their most recent meetings. And it's a 59-year-old gentleman that works, I think, at Boston Children's Hospital. And he's the head of laboratory and radiation safety there. So I'm looking forward to meeting him at the next meeting. But of course, if the Board of Health wishes me to continue representing them, and giving reports back to the Board of Health about what I learned from what's going on at those meetings, of course, I will do so.
I would like that.
Yeah, I don't think we don't need to take a vote. I'm
Yeah.
a little bit more, casual on that, more collegial in the sense that we're all one team. I think Dr. Palmer, that really works well because you're appointed commissioner of that NDCAP through the Senate or through, Beacon Hill. And so that's a great honor, and we'd love to have you represent Plymouth Board of Health in that capacity and report back to us through that process.
Yeah, I should point out they're also subject to open meeting law now. And because of that, I was, as you at the beginning were reading the thing about the guiding principles. I don't think we've had an issue with a problem with the guiding principles on the Board of Health. But other boards definitely have, and even the NDCAP group has. And I think one of the problems is that, and I find it also occasionally on the Public Health Excellence Grant Group, occasionally disparaging talk emerges about somebody else who's on the committee or the board or a different board. And even more troubling to me is that some of these groups, there's a lot of crosstalk that goes on. And someone who's been recognized to speak is trying to make points, and in the meantime, there's 2 or 3 other people having a talk about I don't know what. But it makes it difficult to actually concentrate on the speaker when that's happening. And I've tried multiple times to stop that. And it's difficult. So I guess word of warning to Lorenzo. I don't think we have that issue with the Board of Health, but you have to listen, you have to be polite, and you have to be respectful. And you certainly should never, never engage in disparaging talk about any fellow board member, especially during a publicly live broadcast meeting.
Agreed. I think that, goes well with the guiding principles, at least. So, Dr. Potvin, you'll be our representative from the Board of Health for NDCAP, as well as your other responsibilities within that 4-year appointment. So thank you.
Okay.
The next liaison appointment is the North Plymouth Advisory Group. I did not know that even existed, that we had a kind of connection to that. Did we have someone who's doing that now? Or in the past?
Dr. Reed was on that, and so was I. And as a matter of fact, I also chaired that group. So basically what that came out of was the state DPH wanted us to concentrate on assisting the environmental justice minority population and addressing their health equity issues. And in Plymouth, we're talking about the North Plymouth area where there's a large concentration, probably about 3,000 people, I think, that are actually of
Brazilian.
Brazilian ancestry, who speak Portuguese up in that part of Plymouth. So what we did was to try to assemble a advisory group to help us decide what were their health problems and what could we do about it and how do we approach this. And I think we met just probably twice. We had a lot of people there, including some people from Harbor Health. And we came to some conclusions, and the main conclusions were they had a problem with transportation. Some of them don't even have cars. And so they couldn't even get to health appointments. And so the Public Health Excellence Grant now has travel vouchers that we can give out to those that don't have means of getting to appointments. So we thought, that was moving forward in that, but it's a difficult problem. Wareham also had a problem with that. It's a different minority group, but Plymouth and Wareham really had the only environmental justice problems. But the North Plymouth group probably needs to meet again now that we have made some progress. They have nutritional needs that are not being adequately met. And so we're concerned about what we can do about that, and we have tried and tried and tried. And especially concentrating on the Algonquin Heights area of Plymouth, where there's quite a large minority group, mostly I think of Haitian populations. The trouble now is that a lot of those people are scared to death and they don't want to leave their houses. And you can't really help anybody if you can't get access to them, and if you can't develop a trusting relationship so that they will actually, interact with you and give you feedback and tell you what they need and what they would appreciate. So it's kind of on hold, but I think Dr. Reed was at the two meetings. There was a lot of people there, maybe about, I think Margaret was there too for most of them, for those two meetings.
Yeah,
So
I
she
was
may
there
she may have some feedback about what was going on at those meetings too.
I was there for the first one. There were I know we had couple of the school nurses, Dr. Reed, Karen was there. There was some representatives from a couple of the churches. I miss
Lady from Algonquin Heights.
Yes, yep.
She-
Dee Dee, was it Dee Dee that was there?
Yeah, she's from Algonquin.
She's like, she's the person that they trust.
Yes,
So
yes,
she would be the.
she's
the
very
chair in
good.
that.
Mhm.
So what was the mechanics of it? How did the group even come through? Who was the sponsor? Was it a department within Plymouth? Or was it the Board of Health? I'm just
I'm
unclear
not
of
really sure
how
how
they
it came to
became.
fruition.
What wasn't the sponsor, the
It was
grant?
I thought it was the grant, yeah.
This all came through the grant. I mean, the genesis of having this, correct?
Yes, I
it's-
mean, it came about because the state was pushing so hard to do something about health equity. And we
Okay.
had to identify which populations needed that kind of attention, which we did. And we had to identify what their needs were, which we did. And then the hard part was trying to decide, well, we know what they need. We know what probably can be done, but we have to find a way to make it work. And we got kind of stuck at that point.
So it sounds a little bit, unclear. It sounds like the grant maybe was the genesis of it, the catalyst, right? You can't just all of a sudden, there has to be some sort of leader, some say, hey, we're gonna meet here, we're gonna have who needs to be involved?
Right.
You do
Well,
outreach. and
I mean, that's what I understood, because Barry and Karen were sort of the lead on it.
Correct.
Yeah.
Okay.
So
Karen
maybe-
and I developed, as much as we could, a list of people we thought would be, stakeholders.
Yeah,
And we contacted an awful lot of people, including from the homeless population. I think, what is it, the Kingston Coalition for the Homeless up on the border between Kingston and Plymouth. And she came to some of the meetings. And we got a lot of positive feedback about it. But it really was inaugurated in response to state pressures. The usual sort of thing. We'll tell you what you should do, but we're not necessarily going to give you what you need to do it.
Understood. kind of unfunded mandate.
Yeah,
Now, the question is, you know, and this is, I'm not looking for looking for an answer, but question is, does it need to continue? Was the job finished? Is it, does it need to continue, you know, for the next 18, 24 months? And then if it is, and we're, need to do it, then we could put together a plan and an idea to get it going, but, we kind of have to make a decision here, whether there needs to be a liaison, to this, and we'll go from there. I mean, right now, it doesn't sound like there's, someone that's, you know, that comes to the forefront that would wanna lead this, and I don't even know the entity that would really try to do this, and I think I'll talk to.
Well, I mean, that's the problem. It was never clear to me what the mandate was. And I think we still don't know what the mandate
Right,
is.
okay,
So, I will tell you that it was a very, enthusiastic group of people that know that community really well and had lots of great ideas. The question is, with ideas come, how do you implement it? How do you pay for it? How do you, you know, all of the stuff that come with it. And that wasn't ever clear. So I think we need to back away a step and try and figure out what the mandate was. And maybe we did the mandate, like Barry said, we got a lot of needs assessment out of that area. Is that what was expected? Or do they want us to go the next step and now say, okay, these are the needs and we have to fix them?
right, could, you know, interface or be an input to the job, right? And just bring it up, and that's just having it in discussion, you know,
Yeah.
you're part of that steering committee, you can say, hey, I heard something about the, you know, this North Plymouth Advisory Group with a particular cohort of the Plymouth citizenry that is at risk, right? We've seen it in the media lately, you know, we've seen it with ICE kind of things, and as well as what Barry mentioned, you know, there's hesitancy to be engaged because there's that unknown, right? So that it makes sense around that equity point of view, but I think we to your point, Dr. Reed, we do have to take a step back and understand what the mandate is, and then see within the landscape, where are the real things that can drive, if that's really a need and it gets prioritized, then this, you know, the plan might be out of the chow, or it could be, yeah, let's reconstitute this advisory group. And by the way, it's got some teeth now, because it's part of the plan of that's coming out of the chow that goes into this, what is it, the community health improvement plan. So, more to come on that.
yeah, I don't want to take too much of my time, but earlier today I was digging around about the tobacco regulation, and I found a lengthy set of information from the American Lung Association. And just to give you a tie-in to this, smoking rates, this is coming from their summary. Smoking rates are over twice as high for Medicaid recipients compared to those with private insurance. And some of the smoking rate among adults is much higher when you find people that are diagnosed with anxiety and depression. And 80% of Black Americans who smoke menthol cigarettes, and it goes on and on and on. But obviously, in terms of health equity, also realize that, you know, they're the group that has higher cancer rates too. So they have a whole spectrum of health issues going on. And I think that if we can find a way to specifically, you know, approach those health issues that they're having, it would be very helpful. Again, the problem is you have to be able to outreach to them and you have to have a trusting relationship with them to do it. But certainly, we could concentrate some of our tobacco control efforts on that particular population group. Just as an example of things you could do.
And that goes to like social determinants of health, you know, living in poverty and,
not.
yeah, and even that, like, you think about environmental health in general, lead houses, or housing stock, it's all connected.
Yeah.
The next liaison appointment is the Plymouth School Nurses Wellness Meeting. I think, Dr. Reed, you attend that? Would you continue?
Go to that, yeah, I love.
That's kind of a slam dunk one for you.
A lot of fun.
All right, great. That's good to know. The Plymouth Youth Development Corp. Don't really know much about this information.
Yeah, Karen mentioned it the other day.
Yeah.
I didn't know about it either.
That there's a,
Anybody?
Yeah, I remember hearing about it when Healthy Plymouth existed, they worked with them a lot, Marcia Richards did a lot of it. Or maybe she was Healthy Plymouth, she was my connection to Healthy Plymouth. And then she, but yeah, the PYDC was involved, they were all connected to each other. Or at least talk to each other.
so who
I
was,
can, I can give you information about that because I used to go to that meeting too.
okay,
So that group is primarily concerned with substance use disorder.
Yeah.
Um, and they had, I guess, quarterly, maybe monthly meetings, I can't remember anymore. And there were people from the police department, there were people from, the schools were present in large numbers. There were people from the Y, from Boys and Girls Club, and probably about a half a dozen individual private groups that were there that were concerned about it. So, what goes on at those meetings, and they tend to be between 8 and 9 o'clock in the morning, so everybody can get to work afterwards. Got to be a little bit too much for me, but that's what they do. They think they had some grants which have since expired to help with that particular problem. And I know that in terms of substance use disorder, according to the county sheriff and the police department, Plymouth is doing very well with that. Better than a lot of the other towns in the Commonwealth. They do have a much more, realistic approach to trying to help people with those kind of conditions. Certainly, it's still a problem with the schools. Everybody talked a lot about Narcan. They talked about, depression, anxiety sort of problems that are widespread and often associated with substance use disorder. They talked about suicide risks. So a lot goes on at those meetings. And it's something that I no longer felt that I could cope with. And I think for a while, because those of you who knew David Golden, he had a family history with substance use disorder. And so he was assigned to represent the Board of Health at those meetings, and I think he did go to some. I don't know if he still does or how many he went to. But that was one of the things that seemed to be a good fit for David. I don't know if anybody else on the Board of Health has a background or interest specifically in behavioral, mental health and substance use disorder. But if there is anybody who has that interest, they'd be ideal to go to the PYDC meetings as as I guess the liaison.
Barry, are they in person or are they virtual?
They are in person.
Okay.
It used to be a meeting room at the hospital. There were also a lot of hospital officials showed up at that too. The meeting room we used, there must have been at least 20 to 25 or 30 people present at each of those meetings.
so. Yes, okay. Dr. Reed, right, we'll find out more about the mechanics of it, right? I hear Plymouth Youth Development Corp. I almost wanna Google it and go, who's the president, who's the CEO, means to me like some corporative structure, and there's a chair
I
and.
think it was more core, not.
Core.
not-
Okay,
Yeah.
core. Got it.
With the sweet
EYDC.
S at the end.
Yeah.
Yeah, course.
Yeah.
Got it. And that, thank you, Dr. Reed.
Yeah.
We'll do some research there and then these appointments, again, we'll have, you know, just quick 5 minute, 10 minute,
Yeah.
just, you know,
Some,
liaison appointment updates, and it'll just be a blanket statement who wants to, hey, I was at the last meeting, we talked about this and, you know, it's about trying to make connections and where things overlap and networking. So, which leads to the last appointment, the Southern Plymouth County, the PHE Collaborative. I know that no, that's the grant piece. It does make sense.
That's the grant.
I don't know, Meg.
I would be interested if it's not already owned by anybody,
Okay,
yeah.
Well, I should give you background information about that too. Um, that particular, group, is because a grant, the Massachusetts Association of Health Boards, approached, us, along with people from every one of the 350 some odd communities in the town, trying to put together groups of communities that would receive grant money that they could then use to actually provide supporting services to the towns, to correct the deficiencies in the state mandated public health services that were supposed to be going on. So in the case of the Public Health Excellence Grant Group, one of the first meetings we had, the first thing that happened is we had to appoint chair and a vice chair. Well, I wrote the grant, so they made me the chair. And I rely very heavily upon Karen for a lot of different things. So she became the vice chair. Only one member of the two can vote at those meetings. The other one is the alternate, so if the voting member is not there, the alternate can then vote. At the last meeting that group had, which was just about a week ago, the group voted again to keep Karen and myself now not chair and vice chair, but rather co-chairs. So it was kind of jumping the gun a little bit because all the appointments to that group has to come from the Board of Health at each of the 6 individual towns. So and obviously we can't have more than 2 people because each town only gets 1 voting member and 1 alternate member. So at this particular point, if there's somebody else that's interested in that, it would take a little bit of I guess negotiations as to whether Karen or I should give up that particular position that we currently hold by unanimous vote of the committee. But no one lasts forever. And of course, as time goes on, I'm sure one or both of those positions representing the town of Plymouth will become vacant.
yeah, so I think there's interest by Meg to be part of that. I did get a chance to talk to Mike Hugo earlier this week or last week, I mean. And he, you know, there's a collaborative in Barnstable with the Cape and Islands. I think, Meg, do you?
Yeah, I'm familiar with both of them,
Okay,
yeah.
great. And he mentioned that because Plymouth is the lead town, and it runs through the board, the public health division and through the administration of it, through Karen, that she's someone in Plymouth town government administration is always gonna be a seat of that because all of the kind of things run through that. And then from you know, with the 6 towns, you'll get the 6 board appointed representatives, and then we'll at this point, we'd like to move it forward with Meg as an appointee to that. I think there's synergies around that with the CHA and all of those things, because there is grant money that is I think lasting for 2 more years fiscal year 25 and 26.
For the PHE?
Yeah.
I think it goes to 27.
27, so 26 and 27, and then there's focus around this idea of the SAPHE 2.0 legislation that passed too.
Yeah.
So they're gonna be looking to have the legislation delegates kind of fund that going forward. Right, and if you look at like OLRH, the Office of Local Regional Health, you know, the director there, I believe, is Sam Wong. I mean, over the years, we've seen his organization grow from a handful to a vast support structure. So there's clearly commitment, at least on the state level, to fund these sort of things and to fund them in a collaborative way through the PHE grants. Where there's services that are gaps within the individual towns that are part of it, whether it's an epidemiologist or a nurse. You know, I think that there's usefulness around, at least that's what Mike said, usefulness around coordinating that so that you have slices of a nurse or slices of
Yeah,
an
I've
epidemiologist.
done a lot of work with we've had a PHE set up for some years and,
Okay.
you know, with the shared services coordinator, the epidemiologist, the nurse, the inspector, you know, and just to be able to build on what we all have for, what we have locally, but then regionally, it's such a huge aspect and there. I'm a huge fan of regional, just because it does bring the towns together and understand where they're coming from. And it is funded by the state, so that's a huge aspect of it, but it's not, I have to, like, with the Safe 2.0, and I don't know how you guys are feeling locally, but. I mean, I could use way more help than even the PHE grant is offering, so I feel like those are the kinds of things, like, we need to continue to advocate for additional funding through Safe 2.0 and to be able to get it at the local level.
Yeah, Mike mentioned that from outreach perspective, as a board, we should be outreaching to our
Yes.
delegation, whether
Yes.
it's
Yeah, I do that.
Michelle and you know, Dylan
Dylan
on the center,
Yeah.
just saying, hey, here's some of the things, and you know, not being involved in the PHE directly, understanding what worked, there's some of their successes, you know, we could look on that
Yeah,
website and say, hey, what did you guys do? What did you
yeah.
provide? What did this mitigate?
So
And
there's, I don't know, at the State House, they had these posters highlighting every PHE around the state so that, you know, the senators and reps could walk through a lobby and see each PHE and a highlight of what they are, and where they are and how they do. And so that, when that was there, I definitely reached out to the reps here and then in Mansfield too, to say, hey, come and look and see all the great stuff we're doing. And then at the beginning of June, I was at the Massachusetts Public Health Alliance Awards breakfast, and they were all over. You know, and so we've talked a lot about like, where are those going? And like the MHOA conference, they'll be all over the place to just highlight how much we're doing regionally. Because the posters look great and it's a great way to kind of get the word out to everybody. So,
yeah,
I can give you some financial information about the grant program too. The Plymouth group, which is called the Southern Plymouth County Public Health Excellence Collaborative, received a grant that this most recent year went up to about $550,000. Wish it was million, it's not. And we've used that to hire Devin Donovan. We're in the midst of trying to find a full-time public health nurse. We have a food and restaurant inspector that works part-time, that's helping out with the towns that really didn't have an adequate number of inspectors to deal with their restaurants. All that money comes into Plymouth, and the disbursements from it goes out from Plymouth. All the people who are involved in that, the employees that have been hired by the grant, are all considered Plymouth employees, even though their funding source is entirely separate. And I just today was looking at the new budget that was put forth finally to meet the July 1 deadline for, I don't know how long they haven't done that. But this time they actually did it. It hasn't been signed by the governor yet, But they have a budget that went through both the Senate and the House. And there is $9.3 million in there for the Public Health Excellence Grant Program. Initially, it was 20 million. But because of the money that was coming into the state from some of the COVID pandemic related funding, they didn't need the 20 million from the state anymore, so they reduced it. But apparently the governor has promised Mike Hugo and others that once that federal money is no longer available, which is probably going to happen in about 2 years, that she would push very hard to keep that program totally funded with state funds. So I think it's ongoing. In terms of Meg's interest, I have a suggestion. Since Karen is not a Board of Health member, but I am, we do not constitute a quorum because it's just me. And Karen is from the department, heads the department, obviously. So if Meg wishes to attend those meetings, she could. They are public, they are open meetings, and I don't think that it would probably work well for her to just jump into the meeting as the Plymouth representative without knowing more about what goes on and how the whole thing is managed and handled, and without meeting all the people from the other 6 towns. So I think the first step in that process would be for Meg, if she's available, to come to those meetings. I can certainly arrange that as the chair. She wouldn't be able to vote, obviously, because that's either me or it's Karen. But it's a process of getting acclimated and known, and getting, the ability to give input. So we welcome input from other people, that's for sure, from different backgrounds and perspectives. And I think, within a year or two, if either Karen or I are no longer able or willing to continue in that role, which I think is probably likely, then at least Meg would be ready to step right in and take over to represent Plymouth.
Okay, well, I think part of I'll check in with Karen and understand the process around the appointments. And then we'll go from there. But I think overall, we'll go from that Meg has an interest, and we'll do a Board of Health appointment around that.
Sounds good.
Okay.
Yeah, as far as liaisons go, I asked Mike about that. It does not have to be a Board of Health member. It can be a designee. And so some of the people that come to those meetings are actually health agents from the other towns. I believe at the moment I'm the only Board of Health member that goes to those meetings. Most of them are inspectors or health agents from the other 5 towns. But of course, Karen knows everything and everyone in Plymouth that has anything to do with public health. And so, that's currently the way it's structured. I think I ended up in the position I am because I worked directly with Mike Hugo mostly to develop the grant application that was successful with the state.
Okay.
If that's
Thank you.
okay with everybody, then I will ask the committee at our next meeting. And we're going to have a meeting, I think, on the 10th to actually interview nursing candidates. If anyone has objections or is willing to have another member of the Plymouth Board of Health attend some of the meetings.
Yep, we'll take that offline for now, but
Yeah, you have a good plan.
yeah,
Work with Karen. come
Work
back
with
to the
Karen.
meeting, see where-
and we'll decide from there.
Thank you.
Karen keeps saying we must have succession planning. Because
Yes,
nobody stays on these things forever.
All right, the next thing is on our agenda is the National Sun Safety Month UV awareness. Dr. Reed, if you can walk us through that.
so as you all know, every month is designated as some sort of a health issue. And I thought it would be great to start with this month. July is National UV Awareness Month. UV means ultraviolet, in case anyone doesn't know, and that comes from the sun. Why do we care about it? Skin cancer is the #1 cancer in the United States. It's usually basal cell or squamous cell, which are more benign. It's still cancer, but they're more benign. But it is also caused melanoma. Melanoma is quite deadly. And we have a lot of it here in Plymouth, because of where we live. The number one cause of skin cancer is ultraviolet rays that come from the sun. And that light causes damage to our DNA. The DNA gets most exposed to that sunlight, skin, especially on our head, face, arms, ears. But it can also cause cataract. So this is something else you need to think about.
Is that why you need to wear sunglasses?
That's why we wear sunglasses, yep. So the ultraviolet rays come from the sun. There are two kinds, UVA and UVB. They're equally as dangerous. And once the UV index gets greater than 3, it starts to cause that cell damage. And you'll find UV index listed in newspapers and stuff like that. They talk about that. So
I wonder if it's on the phone.
yeah, it might be. The intensity of UV rays is greatest between 10 AM and 4 PM. That's no surprise. That's when the sun's the greatest. And what can be done? Well, the first thing is stay in the shade, especially during those hours, those midday hours. If you can't do that, wear clothes that cover your arms and your legs. There's lots of new clothes out, use nice summer clothes that have that. Consider your options for your children, especially children under 6 months, because under 6 months, you should not be using the sunscreen. The chemicals in sunscreen are just as dangerous as the sun, so you don't want to be using them on the baby's skin. So they recommend wearing a wide brim hat to shade your face, head, ears, and neck. Now, I'm gonna tell you that all caps don't help. Ask the number of farmers who wear farmer hats, and they get a lot of melanoma on the tops of their ears and on the back of their necks. So those are out, and wide brim hats, different are in. The other thing is the sunglasses. The sunglasses need to be wrapped around. And they need to be ones that block UVA and UVB, so it says that in the, usually on the package. And then use sunscreen, that is at least 15 or higher. And make sure again that the sunscreen is both UVA and UVB. So I want you to have fun in the sun. And these simple items can save your life. A big hat, sunglasses, and sunscreen. So I recommend all of those and hope you have a safe summer.
Terry, I have a question about sunscreen. So sometimes you'll see like they go as high as like SPF 100.
Yeah.
Over a certain level, isn't it like it's not like over 50, it's not that much more
It
effective?
really isn't.
Okay, so you can get away with like a 30,
Yeah.
50.
Yeah.
Okay.
It really isn't. 30, it's the amount of, it's how often you put it on. too.
Right.
And especially if you're in and out of the water, obviously, but yeah, so you wanna put it on in a couple hours, you wanna put it on after you get out of the water,
Okay.
so those things are more important.
All right.
Sure.
And my weather app does have UV index.
Oh, what is it today?
It's 0 right now.
Yeah.
Yes,
Because it's after 4.
yeah,
Yeah, oh,
low for the rest of the day, so we'll have to check it out tomorrow.
right, very good.
Dr. Puffin?
Yeah, with the chair's permission, I came across something else that pertains to this. Because my wife really wants to go to Aruba. And I discovered that in Aruba, they have banned the use of sunscreen products. And I think I'll have to ask Dr. Reed for this, anything that contains oxybenzoic acid or it's the active ingredient in most sunscreens. They do allow you to use sunscreens that have zinc. Dr. Reed, do you know, they said that the reason for this is because they found that the oxybenzoic acid containing sunscreens actually are killing the coral reefs.
They do that in Hawaii too.
Well, I know that the sunscreen in general is, I didn't know
Yeah.
that in particular, but. I mean, the other chemicals in the sunscreen also do that. Yeah. Yeah, if you're gonna go swim with dolphins, they make you take a shower before you go in and swim with dolphins.
Right.
Yeah,
Apparently the zinc is okay.
yeah, it was like.
That's a tough one, like the
You
zinc.
can't tell me off.
Yeah, that's a-
It's all just like that, you know.
Especially when you're already sandy.
Yeah,
Yeah, zinc is hard.
Thank you.
Okay,
Thank you for that.
Yeah.
I mean, it's, when I saw the slide that said what can be done, and I'm so have health equity on the mind, right?
yeah.
So we give things out. You know, we have the tick removal kit and the things like that, but during cyclical times, like we're a beach going, sun loving, South Shore, Cape kind of place. And sunscreen is an easy way to, you know, move the needle long-term wise. And so that's something, if you don't have access to it, then you might not. And if we're not giving them out, you know, I think of like the July 4th parade where people are handing out candies. Like if we were to have the public health, if we were marching, we would be handing out these little single-use packets of sunscreen or in terms of like mosquito, you know, repellent.
Well, there are-
Give it to your mom.
There are some beach locations that have like little sunscreen kiosks.
Oh, that's awesome.
Yeah,
That's
it's
great.
really, I'm pretty sure like Australia has it because they have.
If you
stuff
need
like-
it, right?
Yeah,
Because people
you
with
should get it.
needs have their sunscreen, but if someone doesn't,
Yeah.
you wanna just, you know, promote
Sunscreens are
that.
expensive, especially if you're applying as you should be.
Exactly, like,
So-
she said every couple hours, I'm
Yeah,
like,
it
I'm
is,
an
yeah.
hour.
It is every 2 hours.
Yeah.
Yeah.
Especially the sport.
But you can wear clothes, you can get in the
Right.
shade, use an umbrella, so there are other good you can do.
There's other ways, approaches and mitigation,
Yeah.
you know. So our last.
Even at Fenway Park, they sometimes give out little wet towels that have sunscreen on them to those that want them. You know, it's something that's an example of something that Public Health Excellence Grant could use its funding for.
Yeah,
We did that in
The-
Hartford County.
yeah, I figured as much. So we'll move on to set the date for our August Board of Health meeting. Is there any? It's either 8/6 or 8/20, does it? Anyone have any?
My preference would be the 6th, but I should be available.
I don't have any preference.
I don't
Although,
have a preference.
I don't think they have.
Dr. Coffin, do you have a
I have
preference?
no preference. I don't go anywhere in the summer.
Okay. All right, I think we'll meet in about a month.
I'll
We'll
be in
take it.
Scotland. I don't care what you do in the month.
Yeah, exactly.
I can't make it on the 6th, but I don't know, no, I can, because it'll be virtual.
Yeah,
I'll just be,
it
I'll
can
be,
absolutely be virtual.
yes,
Okay.
thank you.
And then, just like we did this last month, for this, agenda, send any topics that come top to mind and we'll work through that, Dr. Reed and I, and we'll put together an agenda.
I will say you're going to have about probably like 6 grease trap variances, but
Okay,
they're pretty
so-
simple. They're simple ones, so.
Good. No, we'll adjust accordingly.
Okay, perfect.
I mean, this was a great conversation. I really liked the
Yes.
discussion. And setting the stage for our liaison appointments and kind of the updates, this cadence of having updates provided where a lot of us are in different areas and have access to, and it's great to have that transparency and updates. It's good to hear.
Agreed.
So with that, I'll take a motion for an adjournment.
I'll make a motion to adjourn.
Second. Okay, we'll go through the vote. Dr. Reed,
Yes.
Dr. Poppin,
Yes.
Amy,
Yes.
Meg Payne,
Yes.
and yes for me, so it is adjourned.